Psychology of Consciousness, I wanted to show you a lecture that I actually previously recorded a few months ago because it took a long time to add all the necessary diagram and pictures and slides because it's a quite complex topic. And then I was really pleasantly surprised to see how many questions many of you have asked via email, on the module, as well as part of comments to previous videos in regard to multiple aspects of how do we know the best framework to identify consciousness. So I kind of wanted to add the video to perhaps provide some of the answers to the fascinating questions you all have asked. So I also want to use this opportunity to really express my gratitude, how honored I am to be able to teach you these topics, because you really demonstrated insight, knowledge, passion, and perhaps one of the most important aspects, curiosity toward the topic. So that's how we're going to start this conversation today. So you'll see me in two different versions, so to speak. It's almost like the Schrödinger's cat, if you're familiar with the research by Schrödinger, which of course we will discuss in depth later on in the semester. You will see two different versions of me, one that I recorded previously and one live right here, right now, that I added to the previous versions of the module to account for these missing elements. So how to start? Well, let's start with some of the questions that you have asked. Perhaps I can quantify those questions in a summary. And a lot of them have to do with how do we know what we know in a scientific sense. So this is a course in psychology of consciousness, and we already encountered a problem that we attempted to solve in previous weeks, which is what justifies the study of consciousness from a scientific standpoint. And to sum up what we previously discussed, this is how I phrase the answer to this very, very intriguing and insightful question. Well, what gives you the right? What gives us the right is that at the very least, we can provide some elements of discussion, then we can utilize to justify which perspective makes more sense to address that very question. So among the strategies that we previously discussed were strategies that were predicated upon theory. For instance, how can we utilize philosophy to understand science? And if you remember, that is connected to philosophy as epistemology, really, kind of the discussion of what science is, what the parameters are, what questions we ask, the scientific method, the pyramid of evidence. And so it's to some extent an analytic philosophy that attempts to better frame what the question is. Now, the question is also, all right, but is consciousness something that can be studied with a scientific method in the first place? Because after all, if we want to apply the scientific method, we need to come up with some parameters. We need to discuss what units we need to use, what threshold we will need to use, what numbers, what values, what diagrams, what statistical analysis, and what of conclusion can we draw from all of the above to determine whether consciousness is something that, after all, makes sense scientifically speaking. And on top of that, we also need to decide whether consciousness, mathematically speaking, something that is more on a spectrum or in a binary system, on and off, as we previously discussed. So I want to take a step back in order to do that. And let's begin with something that psychology has been studying for the last, I would say, 3 decades at the very least. And so in this sense, consciousness has a lot to do with perception. So let's bring these two terms together. Consciousness on one side, okay, consciousness here, and perception here, all right? Now, let's not spend too much time on the etymology today because we've done this in the past. But for now, let's just assume that these two terms are, if not equivalent, at least to some extent, in some level of correlation, in some sense, there's a dialogue, there is a connection between these two, okay? And we can also mention the fact that from a psychological standpoint, you might have a connection between perception and sensation, all right, sensation, okay? And yet again, let's do this with a big X here that marks the fact that it's not true. You might have attention without perception, okay? Or awareness without perception, or perception without awareness. Let's see if those two things can be both true, and if they are true, whether they're both true at the same time or not. So yes, consciousness is very, very complex, but what would be one of the best ways, perhaps one of the easiest ways to discuss that in psychology? Very often, when we study those things, we need to decide what parameters to use first. And that's where I would like to begin the conversation with, okay? Sensation, okay? In a physical sense, so let's begin with the word itself. So 5 senses, all right? 5 senses. Now, again, there could be a lot of room for philosophical debates here. The 5 senses, the 6th sense, the 7th sense, the sensus divinitatis, if you are within the scholastic or neo-scholastic perspective. But for now, we just mean senses in a very empirical, materialistic, perceptual, body-based perspective, okay? So let's start with the sense of vision, all right? So let's see if we can demonstrate whether consciousness exists in the first place and whether consciousness can be viewed as either an on and off, present or absent perspective, or whether there's a gradient or a threshold or a spectrum of consciousness. Let's start with vision, all right? And this is fascinating because I admit my bias. It's one of the most intriguing branches of research in psychology. So let's begin again with vision, all right? Vision. And 2 concepts I would like to introduce already to add some explanation to the questions that have been asked. One is the concept of blind sight, okay? Blind sight, all right, which again appears to be an oxymoron in the way it's described, and the other one is neglect, okay? Blind sight and neglect. Now, those 2 terms would be very, very important. And if one day you will embark on a research career, a scientific research career, whether in psychology or neuroscience or medicine, or whether you're going to embark on a clinical career, whether in medicine or psychology, you really need to master those 2 terms, because the likelihood that a lot of the discussion that you will have to face, whether you're in the lab or in a clinical setting with your patient, is really, really high. So let's begin to define what those 2 things are. So what is blind sight? Blind sight is the ability to respond to stimuli, especially visual stimuli, simply because that's how the research is constructed, without consciously perceiving them, okay? So you do respond to visual stimuli, all right? Visual stimuli, stimuli, we really want to be specific, without, let me just put it here, without consciousness, okay? Consciousness, okay? And I'll do this, consciousness and perception, okay? So what do we mean by that? Well, we mean that, well, first of all, we can view this as, one is an adverb, okay? Consciously perceiving them, okay? Or you can view that as 2 different nouns, okay? So let me put this option A and option B. Consciously perceiving them, okay? So now you might wonder, this is just, I don't know, semantics or I don't know, pseudo-philosophical mind gymnastics, okay? But let's start from here, because blind sight already determines something, that a part of what we perceive, okay, vision, okay, we see things, okay, it's not working really, right? So if this is the question, assuming that we are conscious only if we can see things, okay, already at this stage, we can infer the fact that we might be, at the very least, less conscious if part of our vision is impaired, okay? Now, this is an assumption to understand, and I also want to mention this, that at the level of theory, for the time being, let's consider vision in a broader sense. We'll see that the research focuses on the occipital lobe, of course, as it should, but we could also transfer some of this element to other aspects of vision, even in a figurative sense. Like, I can see your point. You might not be actually seeing it with your occipital lobe, right? With your occipital cortex, so you don't actually see things in an empirical sense, but you can see it from a figurative sense. I see your point. I understand your point. But saying on the research, okay, you still respond to visual stimulation, so you can make the sense that there is an element of reaction, an empirical reaction to what we actually see, all right? But without consciously perceiving the stimuli. So it is as if part of us is understanding what's going on, but we are not aware of the fact that we are understanding it. Or in other ways, we can phrase this as there is an iceberg, you know, if you want to borrow something from psychoanalysis, right? There's something that's buried, so to speak, or sunk underwater, under the surface. It still responds, it still works, but those things that are underwater do not manifest themselves outside of the surface, okay? So we don't really perceive them. Now, the difference between these two is that this part assumes that consciousness and perception can be viewed at the very least as two elements, two nouns, two concepts that are on the same level, on a gradient, on a scale. In this context, this is, of course, a verb, okay? So it's something that is happening, okay? It's perceiving, and it's something that is unfolding in front of us. And this one is an adverb. So you could say that you perceive something in a conscious manner, which opens up another question. So can a conscious manner being fake, so to speak? Can it be modulated by something that is non-human, for instance? Think about computer science, brain-computer interface, artificial intelligence. Well, we'll see. So for now, think of blindsight as responding to visual stimuli without consciously perceiving them, in the absence of this element of consciousness. All right, so let's continue with the other term. So we mentioned neglect. So neglect has to do with attention. It's kind of an inability to respond, right? So from neglect, okay, from the perspective of psychology, visual neglect can also be viewed as visual inattention. All right, so this brings us back to very basic neuroanatomy, which we previously discussed, and the concept, the observable concept that is predicated upon the contralateral or ipsilateral representation. Again, to remind you of these two terms, contralateral, consider that as an X, okay? So left side of the brain, left hemisphere, right side of the body, and vice versa, as opposed to, where is the blue one? Right here, ipsilateral, same side, okay? So right, left. All right, so let's see how this plays into our visual field, because that's how we're going to study consciousness according to these two parameters, okay? So assuming, okay, this is a theory for now, okay? A theory that is definitely, you know, backed up by science, but that's the beginning of our conversation, how we decide how to study consciousness for now, according to sensation, perception, attention, and vision, okay? So visual field, okay, visual field and the responsiveness to stimuli within the right or left visual field is what we're going to discuss today. So let's begin with a section of the brain. This time I'll do something different. We'll do this section right here, okay, of the brain, okay. And some of the concepts have to do with the visual cortex, of course, okay. So with the optic chiasm, the optic nerve, visual cortex. Let me just write here. So optic nerve, optic chiasm, okay, and then of course visual cortex. Right? So visual cortex, of course, right here. You should already know this, right? Or to get the primary visual cortex, then you have, you know, your two eyeballs here, and of course, your visual retina, okay? Because that's where a lot of our studies are based upon the responsiveness. And then this X-shaped here, let's see if I can do it more clearly here, and that's where the optic chiasm is, okay. All right, so this X-shaped, and of course, this is where the thalamus is, all right. All right, so let's start to assign colors here. Left visual field here, okay, right across the midline there, and right visual field, okay. Okay, now I will use the red color, okay, for the left visual cortex, okay, and I will use the blue because it's contralateral for the right visual cortex, okay. All right, so you can see that there are contralateral. All right, and now let's see how the optic nerves actually work. So we'll do this, okay. Okay, right, and then for the opposite side, of course. All right. Okay, right. So you can see this contralateral representation. So you can see all these optic radiations here, and of course the pituitary gland. Perhaps I can do this in black here. Okay, this is the pituitary gland. Pituitary gland. All right, and these are the optic radiations here. Right, and of course here to specify this is the lateral geniculate nucleus, right? Nucleus of the thalamus, okay, right here. And then the suprachiasmatic nucleus of the hypothalamus, and that is right here, okay. And of course, you see all the connections here. I should have done it earlier. Here we go. All right, which makes sense, right? In neuroanatomical terms. All right. So now you have an overall view of the connection between right, left, and right. An X, right? Again, contralateral representation. Which means that the way we interact in the world, it's also predicated upon what? Interpretation, all right? Now, this is where philosophy comes very, very much interpretation, all right, comes to play a significant role in science. So let's take a step back here to understand what we mean by that. I don't want students or any of you who's watching this video to think that we have, in regard to consciousness, science right here that does all its laboratory work and perhaps all its only statistical interpretation right here of the work, all the calculation there. Then we have, let's say, philosophy here, where unfortunately, poor philosophy, bad philosophy can be viewed as just talking about stuff for the sake of talking, okay? Now, I mentioned this before, I'm Italian, so I like to talk, but philosophy has an embellishing conversational aspect without actually adding anything to the truth, okay? Philosophy as, you know, occupying time and space right here. And then you might have things that are neither just philosophy or just science, things such as metaphysics, metaphysics in an esoteric sense, religion, spirituality here, okay? I want to make sure that we understand that all these things come together not in a democratic process. I'm not trying to say that you need a bit of science here, maybe 30%, 33%, a little bit of philosophy here, a little bit of spirituality here in order to understand consciousness. Because what I'm really saying is that none of these three are really good because they come up with different conclusions, and you can pick and choose, you make up your own thing. This is really a poor way to understand how to study consciousness, because after all, if we need to pick and choose simply based on our, you know, intrinsic, I don't know, taste and motivation, without any real either knowledge or justification as to why we do this, then I'm kind of wasting everybody's time here. I'm just telling you, well, pick and choose whatever you want. This might be true, this might be true, this might be true. We will never know, okay? Now, I also want to maintain some level of humble approach to consciousness. Yes, if one were to say, well, we will never understand consciousness fully, well, I will agree with this statement simply because it's a statement that is very similar to any other statement in pretty much anything else in life. It's not too different from saying, we will never fully understand fever, for instance, okay, or a brain injury or a knee injury. Well, we will never fully understand because each experience is different. So what do you mean by full? But I would argue, though, that we will understand enough within a very specific area of investigation to say that if the conclusions that science reaches in cooperation with the philosophical interpretation, and perhaps, as we will see, with an openness to a spiritual dimension, to a transcendental approach, then we could say that if area A comes with a solution, I don't know, XYZ, area B comes with XYZ, and area C with XYZ, if there is an element of coming together, then we'll have at the very least a higher level of approximation to the truth. We'll be closer to truth. So we're starting with vision here. And again, this is interpretation because we interpret the world first and foremost to make sense of the world inside of us and the sense of ourselves inside the world. So let's continue. All right, so in practice, now that we have this one, if the question is consciousness measurable? If we start to assume that there is such thing as, at the very least, a visual consciousness, then we could say, yes, we could measure visual consciousness, okay? And we do that by, yet again, analyzing visual neglect, that is, or blind sight, okay? So we do have ways to measure, okay? Measure, define, control, and just to answer your question, assign. And by assign, I mean specific values, all right? So I will now start to show you a lot of slides because it will take probably hours for me to draw every single experiment. So I will do that in a very, very fast-paced manner to show you just a few examples of problems. For instance, problem related with agnosia, okay? Agnosia, all right? Or agnosia, if you want to use the Greek, including prosopagnosia, okay? So this partial or total absent visual field perception, okay? Of course, the A in Greek, as usual, is the opposite, the absent, right? Okay. And you remember nausea, gnosis, right? Gnosis as knowledge, right? Gnosis, knowledge. Or in our case, you know, really consciousness. Yes, I do understand that I am drawing a parallel between these two terms that are not entirely justified. I already mentioned, we start from vision to explain things, and throughout the semester, we'll use different methods, okay? But at the very least, if we say that gnosis is knowledge through consciousness or through consciously perceiving something, whether this is possible or not, we can infer that this is a medical problem, okay, that we can account in terms of variation of differences, okay? Prosopagnosia has to do with the recognition of faces, human faces, that is, upright visual faces, which is a very, very important area of investigation in psychology. So let's begin with some examples. So when we think about blindsight, one of the most famous research is the one by VAAS. It's a relatively old research, the early 70s, and it was, again, the study of the stimulus in the visual field. All right, so when we think about this primary visual cortex and the left visual space or the right visual space, we think about possible injuries and problems that define, you know, issues with perceptions. This consciousness is the focus. So if you think about where everything is located, we talk about the midbrain. It's the system that, according to the scientific research, gives rise to sensation without perception. We just mentioned that. So this level of discrepancy between the inner world, so to speak, and the outer world, we're out there. So from your retina, where all the visual elements go through, okay, just in terms of what we can see with our eyes, a small number of fibers go to part of the brain that controls what? Pupillary reflexes that make them expand and make go wider or smaller in order to see. And this is about 90% of the fibers coming from your eye and then go through the lateral geniculate or through the major system that connects the visual cortex, the primary visual cortex. And this is really, really important because all these visual pathways that make our visual field perceptually there for us is pretty much the connection between the retina to the superior colliculus, which is this integrated and integrating system, the tactopulmonar system. Okay, it's this pathway that allows the eyes to really see, cortically speaking, in terms of the nerve fibers, the numbers of them that are activated. Okay, now this is really, really important because, again, the concept that we want to analyze here is that can we see without actually seeing it? Is vision and attention the same thing? Okay? And this is part of studies that date back to the mid to late 1800s, okay, that of course utilize animals modeling. And this is also part of the issues that we have in neuroscience nowadays, that animal modeling is the scientific basis for everything we infer. And of course, we might argue that we are completely different in consciousness terms from dogs, we as human beings. But at the very least, if we have the same neural correlate, the same mechanism, at the very least, we can relate to that in a very solidly scientific manner. Okay, so in this late 1800s, all this research was done to create this understanding what bilateral occipital lesions do to these animals. Okay, so you have these animal models that they're cortically blind. Guys, think about the primary visual cortex, so cortically blind, but their eyes are there, right? So they're not retinally blind. Okay, so the difference between visual cortex and retina. So they're cortically blind, but they're not retinally blind. Very important distinction just in terms of the connection. Okay. So it's in the cortex, okay? So what could they do, these animals, in these studies? So there is something to be said about recognition, okay? So recognizing means to add knowledge to what we observe or extrapolate knowledge from what we observe, okay? We see these things, again, recognition, recognize, okay? So those animals would still, have some elements of missing knowledge, but they would not bump into things, right? So if a person will be completely blind and this means that you cannot see anything, a person would pretty much, bump into objects, pieces of furniture, etc. I'm very clumsy, so I know this for certain. But in this experiment, these animals actually, they were able to avoid things, okay, and they were not able to see in the complete sense of the term, okay? So there is something in the brain that gives more information that doesn't go through your conscious cortex. You see, and yet you don't see, okay? So this is one of the first things to consider when we think about vision versus just perimetry, right? So in many studies, and a number of these studies analyze patients with surgeries, with injuries that occur naturally, and this is really an issue because you never have a very precise area-based injury that are naturally occurring, and that's why it's hard to find these studies, and we should be very grateful to those scientists, those physicians that allow us to study their patients, because again, it's not one specific single area of the brain that gets injured. There are multiple areas, sometimes close to one another, so it's hard to make predictions based on what we observe. But nevertheless, okay, so if you have a relatively large neural injury with a large injury to the right visual cortex, okay, if you have that in the right visual cortex, you would assume to be what? Blind in the opposite visual field, in the left visual field, okay? So if this field is blind, okay, this means cortically blind, so your primary visual cortex in that area is not able to see cortically blind, okay? That there are parts of reality that you see and other parts of reality that you don't see. So how is this done? Well, the patient is pretty much interacting with a computer, with a screen, okay, and they turn lights in various areas of the screen of this monitor. So they create maps, and this is really interesting because it really has to do with maps of meaning, okay. So you need to react to things. You need to push a button when a light comes on, okay, and the light comes on in different areas of the monitor. So in these studies, what happens is that this picture shows you that the person can respond when the light comes on. On the left side, in this specific example, okay, when these lights are shown on the computer monitor anywhere on the left side, but they were never able to respond when the same light came on the right side of the computer monitor, which is it's connected to this blindness, right? This perimetry, okay? And I would say at this point, it's something that gives us the ultimate response of this visual field problem. Let's call it visual field problem. All right. So some of these studies really date back all the way to the late 1800s, some to the early 1900s. Very famous studies in the 70s, early 70s by Weisskranz et al. Were able to indicate that some of these subjects were doing better than chance if forced to guess about whether a stimulus is present in their blind field. Okay, so this is exactly what this ability indicates: the ability to detect stimuli that the observer is not conscious of can extend to discrimination of the type of stimulus. Okay, for instance, where these lights, where these arrows with this O or X has been presented in the blind field. So what does this all mean? It means that there is a discrepancy, a sense of detachment from reality, in a sense that the person is not fully conscious, fully aware of what's going on inside and outside. And even more, in the context of identity, the person might be more or less prone to say, this is not true, it's partially untrue, it's partially misrepresented, or in space and time, it might not exist simultaneously as you claim to exist, which is really interesting because it really has to do with a lot of identity. So this really is where a lot of this research is combined, including the one that we previously mentioned. If you do remember the research by Ramachandran, right? The research by Ramachandran and the research by Gazzaniga, right? Okay. And I would say even the one by Rizzolatti, okay, which we did not discuss in depth. It has to do with mirror neurons, but for now, just keep that in mind. So whether there is more than one of us inside of us, all right? So whether we could view the left hemisphere and its perception and the right hemisphere, its perception, as two different consciousness that come together, which of course, in terms of the visual space, is exactly what we observe to make the claim that we can see a full reality. So again, a fascinating experiment, and this is really important. I just don't want you to be in awe of this experimentation. I mean, that would be a great start if you're all interested in figuring out what these experimentations actually showed us. But part of doing science is actually demonstrating why certain things happen, okay? Or rather, let me take a step back. Let's be more humble as scientists. At the very least, how things happen. You know, in philosophy, very often we say that the empirical science has to do with the how of things, such as mechanism, processes, and more higher philosophical or transcendental spiritual experience have to do with the why of things, theology included. But anyway, just imagine that you have these two visual fields. Yet again, I will oversimplify things here. I don't remember what colors I used earlier, so I will just do this for the right side, okay? And I will do blue for the left side, okay? Now, this is the visual field, okay? So this is the visual field. So imagine that this is a computer monitor, okay? All right. And let's assume that you have a lesion on your one side of the brain. And again, let's assume that the lesion is on what? On your right side. So this is the area where things do not really appear as they should, okay? So let's say problem here, okay? Smiling faces, okay? Because your injury is in the right visual cortex. So let's assume that there are multiple light sources, okay, that appear on the screen, okay? And okay, the screen, of course, is equally divided into halves, okay? All right, okay. So let's assume that you have this false information, okay, where there is an arrow that indicates where the stimulus will come to appear next, okay? So you might have a light that will turn on right here, okay? And then an arrow that will indicate the correct position, okay? So you first have the arrow, you're ready, you see the light, you press the lever or the button, and the light appears, okay? Or you might have the same thing where a light appears here and the arrow tells you, hey, it's going to be appearing here. And of course, the arrow is shown first and then the simulation after. And you guessed that correct, okay? Then you might have some false informations, okay, where let's say the light is here, okay, but the arrow before the light appears tells you it's going to be here, okay, and you'll be fooled, of course, by a few milliseconds, and then you fast enough, you realize that actually the arrow lied to me, or the opposite, the light should appear in the left visual field, but the arrow lies and tells you it's going to be in the right field. So these studies really indicated that there is a different speed in responsiveness, okay, and that people with this unilateral injury will respond differently depending where it is. So just try to guess for a second, what do you think you'll be faster in responding between, let's call it true information, okay, true information. So pretty much this means that the arrow will point to the truth, to the half of the screen where the light will appear. The second, false information, or as many other experiments have done, none. There is so to speak a suspension, an X, all right? Let's call it none, all right? Where an X doesn't really tell you either or, okay? So try to think, where will you be faster, assuming you have any lesion, right? Whether you have an arrow that shows it's right here, and then you respond, and the light is right there, whether the arrow says it's right here, and yet the light is here, or whether you have no information whatsoever. Well, the research is pretty clear, actually. It's intuitively true, you'll be faster if the true matches the truth, as you probably expect. So if the light says, if the arrow says it's going to be on this half of the monitor, and you're already there to press on this side of the screen, and like you're seeing, you'll be faster, okay? And then you'll be the slowest in the responses if the opposite true. So the arrow will tell you it's going to be here and it's here, okay? And then in between, if you have none of the information. This is very similar to what happened, for instance, in penalty kicks in soccer or football, as we call it in Europe, where very often the decision of who's going to pass the screening of the UEFA, for instance, league will pass into the semifinal, finals, and might win the World Cup or not. So penalty kicks and the kick, it might go in the opposite area that you would expect it to be. Now, if you do have a lesion, however, interesting enough, the slowest element is where you are having an experience of missing information in the visual field that has been damaged in connection, of course, to the opposite visual cortex, okay? Which is a fascinating thing that demonstrates this progressive lack of consciousness of what's going on out there. All right, another experiment that I want to talk to you about, it's one of my favorite one, also because it was done in Milan, one of the biggest cities in northern Italy, very close to where I'm from. And it's the research by Visiak and Luzzatti. Visiak and Luzzatti. And it's a really clever research, we're going to participants, by the way, that attempted to investigate what is inside and outside of us by asking very simple questions. So the whole experiment was predicated upon the previous knowledge that the subject had of the Cathedral of Milan, the Duomo di Milano, which is one of the most important landmarks in the city. And they were asking these subjects to imagine a visual field, or rather imagine to see things from two opposite sides. Very, very clever experiment, very interesting, because as usually the case, many experiments are extremely simple in the way they're phrased, because that's exactly how you want to approach the subject. You cannot assume the subject that have necessarily a enhanced knowledge of neuroscientific research. It's probably best if it's very, very spontaneous. And yet with very simple questions asked in a very specific manner, with possibly avoiding any type of bias, you obtain a variety of fascinating results. So this study has a lot to teach us. So what they did in this study, it's again, late 70s study, I think 1979 or 1978, I don't remember. The study indicates that there is an evidence that unilateral spatial neglect, which is this guy, it's not just a problem that we experience in our visual perception, but it has to do with more about mental representation, so that there is a disconnect between the way we perceive the world and the way we report what we actually are seeing, okay? So one of the most important things that the study demonstrated, indicated, that has shown, pun intended, is that problems in visual perception, okay, on one or the other side, hemispatial perception, it's not just a problem of perception in itself, okay, but it's also a problem, meaning with causal reaction to mental representations. This is fascinating because this is exactly where philosophy and science comes together. We create a world, we represent the world. Now, let's take a step back. What I'm not saying here is that because we interpret the world according to our subjective way of seeing the world, this is the reality. That's not what I'm saying. That's what the postmodernists would like to believe. Okay, I'm not sure they really would like to believe, but appear to believe anyway. But there is an absolute, universally correct reality that we might or might not perceive as such. We might perceive as such sometimes, most of the times, only in few situations, or we can perceive half of the time or half of the space, which is really interesting. So this study again, mental representation, okay, mental representation, okay, representation, okay, versus, okay, versus, okay, so also in front of juxtaposition, okay, reaction, mirroring, okay, reflection, okay, visual perception, okay, visual perception, okay. So in an oversimplistic manner, okay, this is what these type of studies indicate. Let me do it this way. Let me just clean this up for a second, and then we'll dig deeper into what the study actually showed. So option A and option B, okay? Now I will be straightforward now, okay? No need to tiptoe on the problem or be unnecessarily politically correct. Let's go this way. A is the truth, okay? Okay. And this is quote unquote postmodernist, wannabe truth. All right. It's nice to joke at times. So these type of studies indicate this, that there is a true element, all of which is valid truth in all situations and appreciated by others. Okay. But you might have injuries that will allow you to see only part of this truth. Okay. This is the type of indication that, at least from the perspective of visual perception, okay, aesthetic perception modality, will indicate. So if the full picture is a square, okay, what the person is able to see is a shape that is approximating the square without being actually the square. Versus the postmodernist understanding of reality is that there are as many reality as we want, okay, which is already bad enough, okay. But not only that, that we can create any type of reality, okay, with any type of shape we want, and they're all equivalent in terms of value and ultimate truth. This is not what the science indicates at all. It is a useful way to interpret reality when, unfortunately, this part becomes no longer science, okay? It abandons science for scientism, okay? For scientism, which is more of an ideology, a cult, okay? So if we are witnessing that, where we assume that everything that this specific only one study indicates is the ultimate truth, then we need some postmodernist attitude to say, wait a second, you can only say that this study indicates that. You cannot assume that you know everything about everything else, okay? So if we become too arrogant, scientistic, and not scientific, then we can use some postmodernist, forced humbleness. But otherwise, the scientific study will indicate are clear in terms of what they indicate, because they're clear about what question they ask, what parameters they use, what type of measurements they implement, and what type of conclusion they can draw upon the previously discussed and mathematically framed understanding. So going back to the study. So it's a fascinating study because few questions have been asked. So what did Bisek and Luzzati ask in this study? They were asking, what do you see? That was pretty much the question. What do you see? And again, there were only 2 patients in this study, which again, it's not optimal in terms of the minimum amount of subjects in terms of inference. But as you will see, because of A, the rarity of the situation, okay, in terms of medical presentation, and B, much more important, the fact you can extrapolate the conclusion because of the very specific and clear processes that underlie perception. This is a phenomenal study. So just two studies. One was 86-year-old, and the other was 72. One was a woman, and the other one was a man, okay? And what united these two subjects that they both experienced the same problem. They had strokes, okay, in the right temporal region, okay, and they had neglect, okay, visual unilateral neglect. So what is it? Yet again, individuals with unilateral neglect do not respond to stimuli for one side of their environment, generally the left. Now, think of this in neuroanatomical neurofunctional terms. If you think about the right hemisphere as this visual, imaginific, omnicomprehensive general perception, as opposed to the left, more detail-oriented, language-oriented, more logically constructed oriented hemisphere. So what happens is that you need both hemispheres to create this mental map, okay, that is connected to what we said previously about the homunculus, the somatosensory cortex, this body-centric approach, okay? So in this unilateral neglect, stimuli that come from the patient's left side are neglected, whichever way the patient's body happens to be oriented in space, which is exactly the point in this study. So what Bisek and Luzzati asked was the mental life of these two individuals and see how they orient themselves in the world. What's their role in the world, okay? So, and also possibly understand discrepancy between what they feel inside, what's the interior world, and what's outside, the external world, the true world. Yet again, let's focus on the truth here, okay? So, whether in their mental representation, okay, in the world of what they experience, in their connection, their memories, okay, they could still come out with a whole picture, okay? So these two subjects, of course, they were Milanese. They were very familiar with the cathedral in Milan, the whole Piazza del Duomo, okay? And they were instructed to first imagine that they were looking at the cathedral of the Duomo from across the piazza, okay? And then they were asked to describe what they could see from this perspective, okay? Now, the first subject was able to imagine herself looking out at the Duomo with all the scalinata, the steps in front of her, okay? So from this perspective, she was able to report seeing the royal palace and many other architectural features. If you're familiar with Milan, you have the Galleria Vittorio Emanuele. It's one of the most beautiful piazzas in Europe. And so everything she mentioned, all these architectural features were to her right in the Piazza del Duomo. None were to her left, okay? So how can the study explain this? Well, one hypothesis was that perhaps the subject did not remember the buildings that stood, you know, on the left, on her imagined left of the piazza. It could be possible, okay? Maybe with age, maybe she was tired, okay? So what the researchers asked her to do was to take the opposite perspective, so to imagine that she was looking out into the piazza from the doorway of the Duomo, right, in the cathedral. Then she was asked to describe what she could see from this point of view. Now, this is very fascinating. So from this second viewpoint, this second conjure up perspective, this imaginative perspective, the subject reported that she was able to see 7 architectural features: the strade, the piazza, the negozi, the shops, okay? And all of these were to her right. Again, they were all on her right. Isn't that fascinating? So in other words, this patient remembered a total of 11 buildings around the piazza, okay? But even in her recollection, in her inner mind's eye, she only seemed to notice that they were on the right, depending on which way her body was oriented, which is fascinating, okay? So this is already an all-provoking results. Let's see what the other subjects experienced in the study, okay? So when they asked the same question, same perspective, the other subject mentioned a few features on his left side, okay? But the authors of this study, so Bisek and Luzzati, noticed that there were something about the exposition of the parts of what he remembers. So they wrote that while central, and this is the right quote, okay, while central and right side items were enumerated in a rather lively manner and sometimes dwelt upon, okay, central and right sided, okay, the few left-sided items were mentioned in a kind of absent-minded, almost annoyed tone. which is fascinating. I already mentioned that in scientific studies, you need to be clear, right? Black or white, on or off, yes or no. Okay, so there's no usually room for emotional spectrum in this case, and yet we can really understand that there is a discrepancy here, right? This absent-mindedness, right? As if there's something that we know to be true, but we don't really feel it is the truth, or the opposite. We know to be false, and yet we're not necessarily quite sure, but there's a discrepancy there, okay? So in both these subjects, and again, this is one of the most fascinating studies, urinary neglect was not confined to the perception of the external world, okay? It actually extended to the realm of their remembrance, okay, of their memories, when they were asked to come up with their mental image of the Piazza del Duomo, okay? So there was a deep organization to their mental experience, this perception, okay? So it is really, really fascinating. So it's something that really brings up more philosophical studies. So how can we make sense of this, okay? So could these two subjects really see what was going on or not? What kind of mental visualization they have? So this is an important situation. It's saying that I partially remember something, but despite of what I'm experiencing, things might or might not exist. And this is, again, one of the differences between cortical blindness on one side and retinal blindness on the other side. So you have two different processes, right? One is an interpretive process, okay? And we mentioned this in regard to possibly bypassing the thalamus, if you think about what we mentioned regarding the olfactory bulb, right? The sense of smell, okay? And to some extent insisting, and there's an emotional component there. Now, you can think of other situations, for instance, with Alzheimer, when there is an emotional, if nothing else, correlation between what we've been asked to reimagine, bring forth, bring back to awareness, and what we experience as the truth. So this connection between mental representation, mental map, and almost insisting that something does not exist, cannot possibly exist, or if you're forced to acknowledge, well, it just came to exist right away. Other studies, for instance, indicate that when you have other similar situations, if you present a subject or a patient with a plate of food and they only perceive what's on one side of the plate, they claim that there's nothing else on the opposite side of the plate. It might be even hungry. And then when you're able to turn, okay, and see that there is more food on the opposite side of the plate, they will insist that, oh, thank you for bringing it. It wasn't there before you asked me that. So there is a discrepancy again in time and space, which again proves the point, okay, that when forced to come to terms with truth, with reality, we might come out with other explanations that yet again present discrepancy either in space, hemi-visual, one on the side, or in time. Well, now it's there, but it wasn't there before. Other experiments, for instance, have been done with showing patients, let's say, a fork and a spoon, and the patient, depending on what type of neurological problem they might have had, either the other part doesn't exist, or there are two spoons or two forks, a variety of that. Or when a patient, for instance, has been asked to draw a clock, okay? And this is also fascinating research. And one of the things that can happen in these patients, I will do a representation right here. I might not be able to show you the original studies because of copyright restriction, but what will happen in these patients that they might have the ability to draw a clock. So let's assume that they just presented them with a blank sheet of paper and they were asked them to read all the numbers. And then if you don't have any type of visual spatial problem, you don't experience any neglect or blind sight, you might be able to do something like that if you have experience in drawing clocks. Well, at least, for my generation, you're able to do that. And if you rely so much on cell phones, you might not be able to read those clocks anymore. But you have no problems in doing something like this, right? Etc., right? Or 24-hour clock do the corresponding thing, and then you can add all the other things around. But what happens in this type of problem is that a lot of patients, because of their missing a visual field, you know, they were putting something like that. Okay, so 1, 2, 3, 4. And then here, there might be some hesitation because there are two things that are happening simultaneously, okay? They are not perceiving the opposite side. So part of their perceptual awareness is telling them something, and yet they're also aware that, wait a second, there's something missing that I cannot reach that. However, this does not necessarily happen if you don't have any other visual spatial field-based perception. So if you have patients where you simply ask them to identify one single time or hour on the clock, they are slightly better at doing that. So they might be doing something like this, like 1, they might be able to do this, 4, they might be even be able to do something like that, like 10, okay, or 8, okay. Although in these two cases, we're talking about the opposite visual field, okay. You understand that there's no problem here, okay, because it is in my field of reality, so I don't have any issue representing that. But if it's on the opposite side, it might be a problem, okay? And this is again connected to what we said so far. If you have this whole representation, your visual field is, so to speak, squeezed. Your mental representation is squeezed, okay? And your whole reality is there. The same way as if we have, oh, I just said, a representation of food, if this is a plate, right, with I don't know, there's some non-specified food on one side, okay, I don't know, maybe some blueberries here, okay, one side, okay, and you might have, I don't know, some chocolates on the opposite side, okay, and assuming that this is really straightforward, divided into halves, okay, again, you might see one side and you might completely ignore the other side. And this is, again, a fascinating thing because it's about ignoring. So we use this term in English as well. You're ignorant about something you ignore. Now, whether you ignore that because you don't see it, this is connected to consciousness. So I don't see it, therefore it does not exist. The same way as where we came from, right, at the beginning of the conversation. I see your point, I don't see your point. Okay, so again, we're going back and forth between different topics. The next installment of this lecture has to do with neuroengineering, neuroimaging. Again, this is a huge topic which we will not be able to cover in full today, but simply because I want to some extent still match the syllabus. I will be talking about that aspect next. And then, of course, in terms of research studies of consciousness, we will have to remember what neural studies and brain imaging studies have to do. And this will also be connected to consciousness as a representation in a gradient, in a scale sense between, let's say, comatose states, partial comatose states, vegetative states, locked-in syndrome, and so on and so forth. So that's what we're going to study next. Now, one of the things that for sure we can think of it is consciousness as level of awareness, right? And whether there are different levels or stages to this awareness. So is there such thing as a series of stages of consciousness? Now, there are plenty of theories, and in the textbook we mentioned but a few, for instance, IIT or integrated information theory, which is the one developed by Giulio Tononi. The orchestrated objective reduction by Penrose and Hameroff. You might have heard this before. Roger Penrose and Stuart Hameroff were instrumental, are instrumental in the discussion of microtubules and the role that this substructure play in the development of awareness. And of course, Stuart Hameroff comes from the perspective of anesthesiology, so physiology and medicine, of course, versus Roger Penrose comes from a solid experience in mathematics, theoretical and applied mathematics. So this is one of the very interesting model. Then you can have the holonomic brain theory by Pre-Bremenbaum, and you have other combination of perspective. And the one that I mentioned here
briefly are the one by David Chalmers, by Damasio, by Metzinger, by Edelman, by Michikaku, by Koch, Pinker, Popper, Roth, and many others. Now, this is of course connected to what we mean by perception and cognition. And every time we think about perception and cognition, we think of altered state of mind and perception. And this in itself could be the center of a whole 15 weeks course. So for now, one of the things that I would like students to remember is the difference between labels that we use in medicine to define different stages of consciousness, where consciousness is to some extent an equivalent of computational awareness from the perspective of medical treatment and therapy. So those terms are LIS, or locked-in syndrome, minimally conscious state, persistent or continued vegetative states, or PVS or PCS, chronic coma, and brain death. Now, very quick here, but by LIS or locked-in syndrome, we indicate a subject as being isolated due to quadriplegia or pseudopulmonary palsy, albeit having awareness, sleep-wake cycles, and clinical meaningful behavior. In a specific case, the syndrome is classified as total locked-in syndrome, and the acronym is pretty straightforward, so TLIS, or completely locked-in state, CLIS. Of note, in LIS, the eyes of the patients are paralyzed as well. So there was a term that was first used by Fred Plum and Jerome Posner. Then in minimally conscious state, the patient has intermittent periods of awareness and wakefulness and displays some meaningful behavior that is demonstrating purposeful or voluntary behavioral response to auditory, tactile, visual, or noxious stimuli. In PVS or PCS, you find an individual that is being given a clinical diagnosis in which a wakeful and conscious state lasts longer than a few weeks with no evidence of sustained, reproducible, meaningful behavior, as well as no evidence of language comprehension and or expression, intermittent sleep-wake cycles, sufficient preservation of autonomic functions to permit survival with adequate medical care, bowel and bladder incontinence, variable preservation of cranial nerve and spinal reflexes. Furthermore, subject in this stage, so again, PVS, PCS, are not aware according to 3 factors, and these are really important. I would like you to remember them, although they will not be present in any specific assignment. It's really important to understand what do we mean by that. So A, the presence of stereotypical ocular, facial, and motor movements seen only with the destruction of higher cortical structures, and again, the discussion of the cortex here is fundamental, accompanied by the absence of any voluntary movement. And by voluntary, of course, we still are connected to the free will debate. B, PET studies that show decreased glucose metabolism in these patients. And finally, C, postmortem autopsy studies showing extensive structural damage that is probably incompatible with consciousness. Now, of course, here you see again this incompatibility. This it's quite unlikely that. Now, this is of course a big statement, because the assumption is that everything about consciousness is in itself part of the brain. And this still remains to be seen, not seen from a medical standpoint. Evidence simply means that it has to do with what you can observe. And yet, 2 things. First of all, what you can observe is either due to possible sensory fallacies, because we rely on our senses, even in the case of mechanisms or technology that we ourselves develop, because all our technology, in the end, whether they're based on specific algorithm or not, still man-made. By man-made, I mean human-made. And the other thing, there might be something that is really hard to account for in the context of what is usually referred to as out-of-body experiences or near that experience, for which I recommend the review of the links below. But let's continue with our labels here, our descriptors. Coma, chronic coma, often simply referred to as coma. This state indicates lack of consciousness and awareness and sleep-wake cycles, failure to initiate voluntary actions, displaying only reflective behavior, and to respond normally to stimuli such as light, pain, and or sound. Finally, brain death. It's a clinical, medical, ethical, and legal definition upon which multiple debates are still trying to provide clarifying attributes. Now, in general, by brain death, we indicate a full and complete loss of brain function, including involuntary processes required and necessary to sustain life. And this requires a certification process, including, and this is the legal, medical, and ethical perspective. Number 1, identification of history or physical examination findings that provide a clear etiology of brain dysfunction. Number 2, exclusion of any condition that might confound the subsequent examination of cortical or brainstem function. Number 3, performance of a complete neurological examination, including the standard apnea test and 10 minutes apnea test. 4, assessment of brainstem reflexes. 5, clinical observation compatible with the diagnosis of brain death. 6, responsibility of physicians. Number 7, notify next of kin. Think about the multidisciplinary treatment team. Number 8, internal observation period. Number 9, repeat clinical assessment of brainstem reflexes. 10, confirmatory testing as indicated. And finally, 11, certification and brain death documentation.
So all these factors really are connected to the main core of this course. So mind versus body, or mind with the body, and whether consciousness can be really interpreted from the perspective of brain and brain alone. Now, we'll mention this throughout the course because it's really a subtitle for the course, Critical Neuroscience, the mind-body connection, or the mind-body problem. Now, among the things that are relevant is the assumption that what we observe at the brain level is what we observe at the conscious level. Now, and one of the things that you can verify on your own is whether things such as field theory is relevant to the mind-body problem. And of course, within field theory, we usually utilize field theory in physics, in quantum physics, of course, and we verify whether field theories of consciousness make sense in terms of the same theoretical mathematical constructs. And one of the issues in this context is understanding whether we can have anything at all that's measurable. Now, anything at all, we really mean mathematically speaking. We have solid numbers to monitor consciousness. And usually when we have numbers, we have to give ourselves at least certain parameters. And we think about physics, well, those parameters have to be the usual time and space, whether it's something along those lines, and whether time and space are in themselves connected. And we find out that, first of all, we might monitor consciousness from the perspective of certain levels of development, so more or less stages, and this is really the computational analysis. So consciousness as an increased capacity or ability, I would say, although this doesn't mean self-capacity necessarily. By self-capacity, we mean there might not be a level of agency or self-autonomy or even self-awareness of the process. We simply mean that there is some level of abilities, okay, of skills, cognitive skills. More means an increased level of consciousness, less means a decreased level of consciousness, all the way to absence of consciousness, and those labels we just mentioned, all the way to brain death. And yet, this only means what we can relate to as consciousness by observing the brain. We do not really have the capacity to say that this exists in the brain alone, okay? Or whether the brain is in itself just as a radio transmitters that it's able to convey certain messages, but the messages exist independently from the brain. That the usual metaphor that I use at the beginning of the semester, where you could view as consciousness or as the self as, I don't know, a music performer, as an artist that you can hear over the radio, and if the radio itself does not work properly because of intrinsic inner problems, there is some sort of technical glitch or issue at the radio, or internal and external problems. For instance, you might have some static that doesn't make the music as stimulating or pleasant to your ears, but this has nothing to do with the performer themselves, or that has nothing to do with the host, okay? So it might be a problem with the radio. Similarly, when we think about consciousness, we can certainly monitor consciousness in the brain, and the brain is the primary filter that allows consciousness and awareness to be filtered out and filtered in. We have the ability to recognize a human being as such through the brain, but to claim that the consciousness exists on the brain, that seems to be that is an assumption that by definition does not find empirical evidence, the empirical evidence of which is only predicated upon the existence of the brain as primary causal factor. And one of those things are really relevant when we think about fields of consciousness and whether consciousness cannot be interpreted temporally speaking. So there's no level of space. We cannot really point out to consciousness as existing in a specific area unless we have secondary observation, for instance, what we just said, we can say that a part of the brain is more conscious simply because we can see an increased blood flow. That's what we said about Angelo Mosso and the earlier techniques of neuroimaging. But whether that consciousness is not diffuse, we cannot make that claim simply because there are different levels of self mnemonic patterns too. For instance, think about memorization processes. The fact that we can recognize ourselves as ourselves in a picture taken when we were, 5 years old, and we can still recognize that we are the same person when we are 10 years old or 12 years old, despite the fact we might dress up differently, we might have a different aesthetic presentation, different clothing, different hairdos, and so on and so forth. So we recognize ourselves throughout time. Now, if we think about neuroengineering, these techniques, of course, have only to do with the brain, or at least with this embodied causal factor, so with our bodies. And we mentioned the nerve growth factor, we mentioned the research by Montalcini, by Hamburger, by Cohen, and so on and so forth. And I would like to conclude this lecture with the very last portion of neural imaging.
And this has to do with what type of techniques we utilize to investigate and develop the implementation of growth factor and regeneration of brain structure, of body structure. Think about cell adhesion molecules, stem cells, and olfactory acidin cells as viral or non-viral factors. Now, whenever we think about stem cells, there's always a series of ethical challenges, and by no means this course can address all of these challenges and all the parameters, because if we think about stem cell research, an important thing to keep in mind is that we're not dealing with random molecules, okay? Whether random molecules exist as a construct, but we're dealing with cells, and again, not random cells, but human cells. And of course, in this context, the biggest issue is that these cells might or might not contain embryonic human stem cells. Now, there are multiple scientists that we should quote when we think about this research. Think about Haeckel and Capecchi and Thomson. Capecchi was awarded the Nobel Prize in Physiology or Medicine for the knockout mice discovery and the knockout mice method. So this had to do with creating mice in which a specific gene is turned off, and he was really the first physiologist, the first scientist to create the first human embryonic stem cell line. And there are many other important names, but there are specific definitions that we need to keep in mind when we think about this type of research. And in the book we just mentioned 3: scientific definition, study on molecular, laboratory, and animal level, and finally possible application on human subjects. Now, we need to remember that the main controversy on stem cells is related to research in human subjects. And of course, its application in therapy and the moral prerequisites and outcomes in social arena. Now, this is also connected to the very definition on when and how and where life starts. All this from the developmental standpoint, as well from the philosophical, transcendental, mystical, theological perspective, and how biological life may be created from the soul. Okay. Now, keep in mind that the term animal, of course, comes from the Latin word for soul, anima, right? Now, just to sum up, in adults there are 4 main areas where stem cells can be obtained. More in particular, adipose tissue requiring liposuction, bone marrow requiring harvesting or extracting, blood in general requiring apheresis, and umbilical cord blood requiring extraction right after birth. Now, although the research, use, and application of stem cell extraction in these areas are not immune to complex scientific, ethical, and social debates, the biggest controversy actually deals with one specific form of stem cells, the embryonic cells, which are especially important as they are pluripotent and therefore potentially able to differentiate into any of the 3 germ layers developing embryogenesis: endoderm, mesoderm, and ectoderm. Now, this is really connected to what we just said earlier about neurogenesis, neuroplasticity, and the fact that there seems to be a life force, a creative path that underlies everything that exists from a biological standpoint. And I don't think I'm pushing too much in claiming that this element has some sort of spiritual, I dare to say, sacred element.
as in sacred life. Now, of course, you might interpret sacred as a theological term or religious term, but sacred really means, from this perspective, separate from the rest. Okay, so there's a special element that is predicated upon the function, a function that can take on multiple roles. So as if life is life itself, and then it can take on different clothes, for instance, depending on which type of further development this cell, as an example, will become. Wonderful. As we are approaching the very last few minutes of this lecture, everything we shared so far has to do with our attempt to provide solid biological evidence for everything that is a neural underpinning for the discussion, whether it's neural underpinning of behavior, neural underpinning of emotions, cognitions, awareness, and consciousness. Now, everything we said so far is, I would say, less up for debate, simply because we have sufficient scientific technologies to verify the existence of all these processes. Now, this does not mean, however, that these processes are all there is, because this one will really be addressed starting week 5, right? But it's important to master those basic pieces of knowledge to understand what the brain is actually doing, okay? In the mind-body connection process, we have to really focus on the brain first, okay? Because it's the neurological basis, is what we can all agree upon. Now, in this context, though, we will also have to better understand what we just said regarding the existence of a possible field of consciousness, the theory of field of consciousness, and whether fields of consciousness have any validity in terms of theoretical approach to investigate human awareness, human existence, human ontological reality. So again, we can account for consciousness, we can measure the neural correlates of consciousness from a computational standpoint if we can focus on some level of connection between time and space, where time is simply the passing of seconds, or milliseconds, minutes, and so on and so forth, and space has to do with the amplitude of certain waves. For instance, you can monitor rate coding, the spikes rates, or you can use temporal coding, the selective reinforcement of spike coincidence active neurons and network, so that you can combine time and space simply for these neural correlates. But the question remains, is this really consciousness? The question is really not just a philosophically constructed question for the sake of a poetic debate on what it means to be human. It has a very solid rationale behind it. And this is, so far, nobody was able to demonstrate how consciousness arises from matter alone. Now, on one side, you have the whole debate on whether consciousness can account for itself in a rational, ethical, social even standpoint, whether we have enough judgment that can originate from matter. But even less than that, the very fact that we have consciousness, it's nowhere to be found in the level of space. We can find it throughout time, and this will be one of the maybe primitive, somewhat naive way to interpret that. I understand who I am. I understand my own conscious process, similar to some extent to the I think therefore I am throughout time, based on all my experiences on a continuum, right? That I can identify myself based on what we said earlier. I can recognize myself at different stages of my development. And yet, so far, matter was not able to determine the origin of consciousness. You cannot find any solid rational evidence of this mechanistic explanation. So in our mind, this is at least not logically coherent. In fact, it's a false assumption to make that we find consciousness through biology. Also, there's another factor here, that the very problems according to which we interpret biology are not self-evident through biology, but they are constructed from fields such as mathematics, physics, and by that I mean theoretical mathematics, theoretical physics, all the way to philosophy. Matter itself does not account for either its own existence or its own parameters of development, origin, and functional structural components. So I would like to conclude this for now with this idea of the false assumption that we can find rational reasons to claim that consciousness originates from matter alone.
All right, back to current reality. Just a time to change my jacket, shirt, and trim my beard. But joke aside, so emergent property, okay, consciousness emergent property that does not originate in matter alone. All right, so let's take another look, the last one, and I will let you go to emergency. All right, and the term emergency, of course, is something that we're all very familiar with, especially if you are in the medical field or in first responder, etc. It's something that comes out, okay, last etymological tour here, okay, that comes out, right, like an X, okay, that is merging, okay, emerging, okay, right, okay, and therefore there's something that like a stone thrown into a lake creates a sense of progressive wave-like structure, okay, that is progressively approximating the horizon, okay, that assumes that there is an element of reality underneath the surface, okay, and a corresponding element above the surface. And for now, we only have two dimensions, but of course, we can talk about depth of perception, right? Okay, depth of perception, okay, width, length, etc., etc. So these are very big assumption that we make, that consciousness is more than just matter, all right? But at the very least, that's where we began our conversation today. Can consciousness be measured in a scientific sense? I would say the answer is yes, absolutely. Now, whether we can view these things that we measure as correlates of consciousness or as ultimate truth, this is something that we'll keep discussing in the future. But one important thing I really want you all to understand here, that it's more psychological interpretation, is that please refrain from considering this as a debate where you need to prove the other person wrong. Now, yes, that's what science does. We need to have, at the very least, the understanding that one of the hypotheses has to be proven wrong, otherwise there's no advancement, there's no discovery, there's no intrinsic value to what we're doing, okay? But we should prove the assessment, the opinion, in other words, or even better, the statement as wrong, not having this sense of pursuing domination for the sake of embellishment of our ego in the modern sense of the term, okay? So, example, if we postulate that consciousness is more than just matter, okay, then we will need to do something with this postulate. We should quantify it as a variable. And let's see if these variables are something that, at the end of the day, we can also find in our laboratory experience or in our personal everyday life. All right. Well, thank you very much. Very long lecture today. But again, I'm honored that you asked all these questions. And it's a good thing that we can interact, in this virtual world as well, so that we make this whole semester more integrated in a sense. Thank you very much. I'll see you all next week. And as usual, feel free to ask me any questions or add comments that I will gladly add to the next video. All right, bye-bye.